from a purely logical armchair maximalist approach, the most possible nasal breathing benefit that you're going to get is to do a MARPE with minimal surgical assisting so as to get the expansion up the y-axis and down the z-axis, and then do an MMA, which affords its own unique nasal breathing benefits. But the MARPE has certain things it can do that the MMA can do for nasal breathing, and the MMA can do certain things that the MARPE can't do for nasal breathing. And logically speaking, stacking the two of them, MARPE first, followed by jaw surgery, is the best total units of nasal breathing improvement that you could potentially get. Do you agree with that statement?
That would be my opinion. And I totally agree. I think that was well said. I think you can get lateral expansion of the nasal cavity, maybe even of the, which is not, you're not going to get superior expansion with MMA. That's just not the case. But then you get the things like you can lower the floor of the nasal cavity by pulling the maxilla forward. You're pulling the soft palate forward in the back. And so if you think about it, the outlet of the nasal cavity is the nasopharynx in the back of the nose. That whole area in the back of the nose is pulled forward and opened. So you get a much bigger kind of, does that make sense?
Yeah, I'm going to load up an image.
Yeah, perfect. You're pulling that soft palate forward. And so now you have a lot more space behind the nose. So you don't want
a good image.
Yeah. So if you're looking at that soft palate, which is, what your uvula and kind of the roof of the mouth is attached to, yes. Right there. When you move the maxilla forward, that whole segment is getting pulled forward, 8-10 millimeters. So that's the bone of the hard palate maxilla.
And that ends right here.
That ends right there. And this is the soft tissue attached to the maxilla. So if you look farther down, this is the uvula, all the muscles of the soft palate. All of that is attached to the maxilla.
Yeah. And right. That's all this stuff here.
Exactly. Those are the muscles of the soft palate. And so, in traditional ENT surgery, we would do things like a UPPP or pharyngoplasty, where you would cut that or you try to pull it forward or tighten it. And I still do a fair amount of pharyngoplasties where it's not, where you're cutting stuff out, but you're repositioning, you're trying to pull that muscle kind of forward and out, almost like to give the soft palate a facelift. But essentially what an MMA does is it pulls that soft palate forward. So if you look right above the soft palate, that is the nasopharynx or the back of the nasal cavity. And that part opens up much more. And so this kind of, the choke point ends up being opened up. So now the nasal cavity is widened with the MARPE, and the back of the nasal cavity is opened more with an MMA.
Right. Wow, man. That sounds like it would feel amazing. I think it's so funny. You describe your typical patient coming in off the street from a local provider, being totally freaked out by like this MARPE splitting my skull in half like a Chinese torture device. And then this MMA surgery, which sounds like, death incarnate, getting my jaws hacked off. Oh my gosh. Whereas my audience is like, oh, please.
Exactly.
That's all I want for Christmas is an MMA.
So that it's funny because I still have a fair number of patients that, either will, follow your podcast or like are much more, they've done their own research. And so, or they come in from, an orthodontist. And when they come in from an orthodontist, they're kind of already have an idea that their jaws are too small if they have dental crowding. So those are the best patients for skeletal surgery that come in already knowing that there's an issue rather than, me in a 20 to 30 minute visit trying to explain to them that, their jaws are too small.
Yeah, but we're kind of a mixed bag too, though, aren't we?
True.
Sometimes we're a little nutty, aren't we?
Yeah, there's a happy medium, I think, that needs to be found. So I think, and that's kind of where, as an ENT, I think the important thing, and we were talking about this offline beforehand, is like, not everything from sleep apnea is also structure related. And so that's a really important thing. It's not all jaw structure related, I should say. So, you were talking about how Dr. Gunson mentioned, potentially getting a DICE or at least getting a scope in the office. I think that's really important because if you do an MMA on someone that has big tonsils or a big lingual tonsils on the back of the tongue or some other kind of soft tissue issue, you're going to have incomplete improvement in that patient. And so some of those patients may need to do some kind of soft tissue surgery first before they do an MMA. So, like in kids, if they have big adenoids and tonsils, if they're obstructing their breathing, do you want to wait for a MARPE to hopefully, maybe improve their lingual tonsil tissue or tonsil tissue in like 5 years? That patient needs immediate resolution of their issue. So you do, maybe a TNA, which is a tonsillectomy and adenoidectomy, and then you think about, okay, now let's do a palate expansion or do some of these other things to fix the structure. And I think the same goes for skeletal surgery, is making sure that there's not some kind of low hanging fruit that may, one, get faster resolution, or two, now that easier to recover and you might have better outcomes from your MMA if they don't still have redundant extra soft tissue kind of blocking the airway.
Right. Yeah. One interesting thing that I learned during my jaw surgery consult adventure in California with Dr. Bell, Dr. Gunson, and Dr. Wallin, and I will be talking to Dr. Alfie eventually. I didn't realize you did MMAs. Hey, maybe you and I will talk too. But,
right. I don't do cheek implants though. So if you want those, I'm not your guy.
I need cheek implants and I need an orbital box osteotomy to increase my IPD.
Yeah, right.
Someone did that, by the way, with the Turkish surgeon.
I saw some YouTube videos that a colleague of mine sent me and was like, "Is this real?" And that's
real.
Talk about maximally invasive stuff.
Yeah, that's giant implants. He's kind of a legend in the Looksmaxxing space.
Yeah.